Podcast 10 of the Pelvis and Perineum series, the branches of the internal pudendal artery and pudendal nerve. This podcast is the last of the podcasts that are looking at the anatomy of the perineum, and this one is going to detail the branches of the internal pudendal artery and the pudendal nerve. So in order to fully understand the pathway of these arteries and nerves, you need to be familiar with various spaces within the perineum. These are the ischial-anal fossae and both the deep and superficial perineal pouches. So if you're unsure of these, then you should listen to the previous two podcasts and then return to this one later on. So the main artery and nerve of the perineum is the internal pudendal artery, the terminal branch of the internal iliac, and the pudendal nerve, which comes from S2 to S4. This neurovascular bundle leaves the pelvis via the greater sciatic foramen between piriformis and coccygeus muscles. It extends a short distance in the gluteal region before looping around the posterior aspect of the ischial spine to enter the pudendal canal of the ischial-anal fossa via the lesser sciatic foramen. As this bundle extends within the pudendal canal, along the lateral wall of the ischial-anal fossae, it gives off the inferior rectal artery and nerve. These course medially towards the external anal sphincter. As the internal pudendal artery and pudendal nerve continue anteriorly within the pudendal canal, they give off numerous branches. Here the internal pudendal artery bifurcates to give the perineal artery and dorsal artery of the penis or clitoris. The perineal artery runs through the superficial perineal pouch to supply the posterior scrotum or labia. The dorsal artery of the penis or clitoris extends through the deep perineal pouch and initially gives a branch to the bulb of the penis or vestibule. This artery supplies the corpus spongiosum. As the dorsal artery continues towards the anterior margin of the perineal membrane, but still within the deep perineal pouch, it gives off the deep artery of the penis or clitoris. These enter the crus to supply the corpus cavernosa of the body of the penis or clitoris. Finally, the dorsal artery penetrates the anterior margin of the deep perineal pouch to run along the dorsal surface of the penis or clitoris, supplying the glands and superficial tissues. I've quite deliberately mentioned the internal pudendal artery here, and that is because there's also an external pudendal artery. The external pudendal artery originates from the femoral artery in the thigh. This artery courses medially to enter the perineum and supply the anterior scrotum or labia. The pudendal nerve follows a similar course to the internal pudendal artery. Once the pudendal nerve has given off the inferior rectal nerve, it bifurcates into the dorsal nerve of the penis or clitoris and the perineal nerve. This dorsal nerve runs through the deep perineal pouch to innervate the glands and then runs along the dorsal surface of the penis or clitoris. This dorsal nerve runs through the deep perineal pouch to run along the dorsal surface of either the penis or the clitoris to finally innervate the glands. The perineal nerve splits into deep and superficial branches, and as their name suggests, the deep perineal nerve runs through the deep perineal pouch, supplying the skeletal muscles of the urogenital diaphragm. Those, remember, were those flat, disc-like muscles that surrounded the urethra or surrounded the vagina or run along the posterior edge of the perineal membrane. The superficial perineal nerve enters the superficial perineal pouch to form the posterior scrotal or labial nerves which innervate these regions. Remember though that the anterior scrotum or labium are innervated by the ilioinguinal nerve and or the genital branch of the genitofemoral nerve. So in this podcast, I've briefly gone over the main arteries and nerves that supply the perineum. In the next podcast, number 11, I'll detail the main autonomic nerves of the pelvis.